Hi, Dr. Karthik here again from the Metromale Clinic. So I hope you watched my video on how to collect a semen sample, but I was also telling you about the difficulties that men face while actually collecting a sample, and oftentimes the commonest complaint that we hear from them is that they're not able to sustain their erection when they're actually trying to collect a semen sample, and sometimes they just can't masturbate in a room that you provide at the clinic. So, what are the other options that these men do have? Now, one of the things that they can actually do is something known as coitus interruptus, which means they collect the sample from home. Now, even masturbatory collection for these men do not work at home. So, what they can do is they can try and have sex with their wife, and when they do with a condom, and you have to ensure that these condoms are free of spermicidal agents, no spermicidal agents, and once they feel like having an ejaculation, there is a process known as coitus interruptus where correctly during the time of ejaculation the man pulls out the penis with the condom out of the vagina and ejaculates it into the condom. Now this condom can, with the sperms, can either be transferred to a sterile container that he has already taken from the lab, or the condom per se can be brought quickly to the lab because it's non-spermicidal. So that is one technique that men can adopt. The second thing that they can do is when they don't have an erection is for the time being take a PDE5 inhibitor. So you know that PDE5 inhibitors typically improve the blood flow. So because of anxiety and lack of stimulation, if they do have these issues, then maybe the PDE5 inhibitor can help. So this is something that we typically do in our setup, and it also helps to have the partner inside. Maybe if he's not able to masturbate on his own, then maybe his partner can help with the masturbatory aspects. Now, having said all this, finally, if nothing else works, and the man has typically been an ejaculator, meaning you have to understand that an ejaculation is probably one of the most difficult conditions to treat in andrology. So during that point of time, what we can do is provide the couple or the man with a vibrator. Now this is a penile vibrator, and what it does is the most sensitive part of the penis per se is the glans, and particularly near the frenulal part, near the frenulum. So the vibrator has two surfaces. So the glans typically is held between these two surfaces near the frenulum, and the vibratory blades make a movement like that, and that actually produces an ejaculation, and this can be collected into the container. So in men who don't have in men who have problems doing a collection, so these are the alternatives that we can adopt, and typically in a clinic setting a vibrator would definitely help.